is Varsha Sharad. I'm a speech language pathologist at Lorem. So today we're going to see about virtual autism, which is very much common considering the ongoing pandemic and our current lifestyles. So what exactly is virtual autism? We see a lot of children who have similar symptoms that of children with autism, and mostly this is due to their excessive screen time exposure. Excessive here means like more than 2 to 3 hours of screen time exposure. And screen time. So generally parents who are not able to manage their child end up giving a lot of telephones or say phones, gadgets, YouTubes. They are being more exposed to media nowadays. So a lot of children just learn the way how in media people speak or the cartoons speak and try imitating them. In most cases what we see is they have a lot of similarities that of kids with autism, but one difference is that as soon as these gadgets are being removed from their daily life, or if the environmental conditions are being changed by the parent, we see a change in the behavior of the child. The child's behavior changes drastically, and we also see that when we work or give them extra therapy to them, they are better. And children, after being exposed to a long screen time exposure for a long period of months, what happens is they no longer relate to what's happening around them. Second thing is they might repeat words or rhymes, whatever it is, but they don't know how to use it in a real life situation. So when they're asked a question or when they have to communicate with someone of their own age group, they do not know how to do it. It's mostly because all of this is a one-way communication. So a child sees the media or any program, but they're not expected to reply or even respond to such things. But in a social situation, when a parent is speaking or anyone else is speaking, they expect a response or a reaction, but the child doesn't know how to do it. So here, we also see most of the children have some behavioral issues. So it can be crying or them becoming very aggressive. All of this is because they do not know how to communicate their needs or wants. So they think by crying or showing aggression, they can get the attention of parents or the parents will understand them. And most of these things, what we can see is when a child below the age of 2 years is being exposed to say YouTube or phone for a long period of time, they end up affecting their normal neuronal development, causing delays in social, cognition and speech related areas. So what are behaviors we can see? We can see that they no longer maintain eye contact or they do not respond to name call. In most cases, there is a delay in speech and they show abnormal behaviors. So all of this causes a concern to the parents. Now, as parents, what can you do? The first thing is to stop the usage of media time or phones. Just remove it from their daily lifestyle. The second thing is to contact a professional, be it a speech language pathologist, an occupational therapist or a child psychologist, and get an overall assessment done. So after the assessment, we can start an early intervention. So in early intervention, we have seen remarkable progress not only in their speech but also in their overall behavioral development. So what can parents do about this? The first thing is to not give gadgets to the children at a very younger age, say for 2 years of age. Or if you've already given, then we need to remove such gadget or applications, any such media exposure to the child as early as possible from the child. The second thing is to visit a professional, be it a speech language pathologist, an occupational therapist or a child psychologist, and get an overall assessment done. So here, early identification and intervention has shown a remarkable change in the child's life, be it their normal development or speech and language development. So that's the best thing you can do for your child. Thank you.